We are now going to reconvene in open session. And the first thing on the agenda is public input. None. We have Jenna Montgomery from the Neshoba Associated Boards of Health to do a program for us. Or are you waiting for somebody to?
Someone's joining us
Okay.
on Zoom via phone call momentarily,
Okay.
but we can start. I don't
Okay.
have a problem with
Okay.
that. Okay. Thank you so much.
Can you just hit the admit, because I want to have
Yeah, I can do that.
Thanks.
Where is that?
this. You won't see it yet.
Okay, okay.
It'll be quite clear.
I'll just keep my eyeballs up there. All right, hi everybody. I'm Jenna Montgomery.
Hi.
We met before. It was months ago though, so I figured another introduction doesn't hurt. So I am the public health educator and communications specialist with Neshoba Associated Boards of Health. The last time I sat down and talked to you guys, we chatted about my new role and what I would be doing, and one of the things I brought up was the possibility of mobile harm reduction services in Ayer. Happy to say that we've got that to a more cohesive point now where I'm able to come in and present about it and give you guys a little bit more information. So Nate Irwin will be joining us on Zoom. He's the community engagement facilitator with the Healing Communities Study through Boston Medical Center. He is driving, so he will be on the phone only.
Oh, okay.
He's coming back from a wedding down south.
Oh my
Yes.
God.
I know.
And what is his title again?
He is the community engagement facilitator with the Healing Communities Study. The Healing Communities Study has been working in this area, specifically Shirley and Townsend, but also surrounding towns, including Ayer, for the past couple of years. And they're going to be wrapping up. We're sad to see them go, but it made a really wonderful impact in the area. But the end of June is when they're going to be kind of moving out of the area. So one of the last sort of prongs of the initiatives that we're trying to get going is mobile harm reduction services, because from my perspective and also from a DPH perspective, a CDC perspective, there are a lot of potential benefits to that, specifically for underserved populations in the area. So joining me today, in addition to Nate on the phone, I have Jane Carpenter, who's the community data manager with the Healing Communities Study from Boston Medical Center. And Dr. Avik Chatterjee is here. He's also from the Healing Communities Study and works with Boston Healthcare for the Homeless.
Okay.
I almost said next slide, like somebody else was going to do this. Yep. Page down.
Try the mouse. Try scrolling the mouse.
Scrolling.
Oh.
Check it out.
Many ways to do one thing.
Great. So our objectives today are. Hold on one second.
There it is.
Nate, can you hear me?
Not yet.
No. Okay.
He's still muted.
I try to move this out of the way.
Yeah.
Like that would be right where I need it to be.
Let me help.
I think the issue is if he called in, he might not know how to unmute himself on his phone. So
Oh,
you have to
right.
press like star or something.
What happens if
Cindy
you
can
just
usually override these things.
Past that.
Yeah, what happens?
Yeah.
Just do that. And do that.
Oh.
Look, you're just a wizard.
She is.
And
You
it's
are.
decades, it seems. Okay. So,
All right. Well, Nate's gonna have a couple comments for the end, but mostly I'm just gonna run through the presentation first, so we can work it out in a second. So our objectives for today, I would like to help you guys understand a little bit of the history and evidence for syringe service programs and mobile harm reduction programs, what they do specifically, right? And then also a little bit of an overview of state laws and local approval processes for a syringe service program in a town or a city. So in 2021, the Biden-Harris administration actually had harm reduction strategies as a part of their overall plan. Like these were some things that they really kind of wanted to see happening nationally, and were kind of pushing through the Office of National Drug Control Policy. So this was wonderful to see. As you can see here, the first 3 objectives involve SSPs, including access to naloxone, helping to link people to treatment, right? People who use drugs, making naloxone available. Naloxone comes up a lot, right? Because that's one of our primary, I guess, tools in this battle. And then research on the efficacy of clinical effectiveness of some of these interventions. We've got a couple of decades of evidence indicating that SSPs work and why, which is what I'm going to go into next. So scientists, including those at the CDC, have studied SSPs for more than 30 years and found that comprehensive SSPs benefit communities. So what would a syringe service program do? So they help save lives by lowering the likelihood of deaths from overdoses. That includes because people are having a regular touch point with the community where they're coming to see someone. They're handing out naloxone, they're educating on how to prevent overdoses, like if you're choosing to use, here's how to do it safely. They also provide testing, counseling, and sterile injection supplies to help prevent outbreaks of other diseases. So SSPs are actually associated with a 50% decline in the risk of HIV transmission, and also hepatitis C as well. Yep. Users of SSPs were 3 times more likely to stop injecting drugs. Again, it's this frequency of contact with a touch point that can link you to resources. Right, so, if not everyone is always in the mindset, I'm ready to recover, but when they are, you have a really quick window to act when they're in that readiness to change. So the more often they're contacting the community in that way, the more likely it is that you're going to catch them at a time when they're receptive to a referral to further services. Law enforcement benefits from reduced risk of needle sticks. There's no increase in crime associated with SSPs demonstrated by research, and the ability to save lives by preventing overdoses. When 2 similar cities were compared, the one with an SSP had 86% fewer syringes in places like parks and sidewalks, which is really impressive. I think that debunks another myth that having a syringe service program increases the number of needles that are going to be around. It's actually the opposite. So what do syringe service programs do? So this infographic depicts a brick and mortar SSP. In rural central Mass, we'd be looking at a mobile clinic or van to be offering these services. So some of the things that would be available in a program like this are vaccines for diseases like Hep A and Hep B, testing for diseases like HIV and Hep C, counseling on treatment and prevention of HIV, Hep B and C, such as antiretroviral therapy and pre-exposure prophylaxis, referral to substance use treatment, medical care, mental health services, and other support services, and access to and safe disposal of sterile syringes and injection equipment. So I kind of want to go back to the referral to substance use treatment, medical care, mental health services, and other support services, because from my perspective working with Neshoba, I see that as, in doing kind of my overall thing with the boards of health to start, I found mental health and substance use were a couple of places that were really lacking in terms of access to treatment in this area. I love the idea of having a mobile clinic that actually comes out to people in an area, maybe people who aren't otherwise able to easily get access to treatment, where they can get linked to those types of services. I think that would be really beneficial, because I think that those resource gaps, where people have to travel to Fitchburg or maybe can't find somebody who accepts their insurance, those kinds of things would be kind of mitigated by a service like this.
Yeah.
So here is just a quick little timeline of SSPs in Massachusetts, right? So in 1993, DPH authorized MGLC 111 215 to issue regulations related to a pilot needle exchange program and decriminalize distribution and possession of hypodermic needles as long as distribution and possession were done as part of a pilot needle exchange program. So that was 1993. I'm gonna out myself and just say I was 2 years old when that happened.
Oh,
so this has been going on for a real long time. It's been going on for a long time. That was a long time ago, guys.
I know.
And then, kind of all the way through to 2017, state budget signed by Governor Baker contains outside section with language amending that previous MGL, removing cap on programs and specifying a local board of health as the authority over local approval. In Massachusetts, syringes are actually not a crime. In 2006, Mass General Law, Chapter 94C, was further amended by Chapter 172 of the Acts of '06, decriminalizing the distribution and possession of hypodermic needles, regardless of any involvement in an exchange program or the issuance of a prescription. So this allowed for over-the-counter purchase of syringes at pharmacies and their legal possession. So as of September 2006, anyone over 18 can purchase needles from a pharmacy without a prescription, without fear of criminal prosecution. Pharmacies are not mandated to sell syringes, but if they do, they must sell them to all customers over the age of 18, of course, who request them.
I don't think I knew.
So syringe service programs in Massachusetts. Now, this is older data, right? As of July 2021,
Yeah.
almost a year ago. 39 cities and towns in Massachusetts had local board of health approval documented by an official letter, and 29 cities and towns were operating an MDPH-funded SSP. So, 17 agencies have MDPH funding to provide SSP in Massachusetts, and 34 operational MDPH SSP programs in Massachusetts are running, and several cities and towns actually have more than one SSP. So this is actually a map of syringe service programs in Massachusetts.
Oh my God.
So the red ones are brick and mortar locations where the little blue guy with the van in the middle is a mobile operation. And as you can see, our area
There's
is
nothing.
sorely lacking, right?
Nothing.
So I see this as potentially an opportunity to close a gap and, lead the charge in the region of getting these kinds of services into a place that really needs them, where people have a hard time accessing treatment.
Yeah.
Jenna, are these data driven? Any of these, do you see an increase in usage in certain areas where I know the cities,
Yeah.
definitely, but like areas that we're talking about in Neshoba Valley, is there?
You mean just general
Yeah,
levels
I'm
of
just wondering how they go about
usage?
deciding where the mobile facility would go and how, and which towns they see an uptick, or cities and towns that they see the greater need.
Right, so that in part will be something I think I'm gonna have Jane speak to, because she's our community data
Okay.
manager. She's got some data to present. But also, when the Healing Communities study originally, it's a National Institute of Health level study. It's taking place over several years in 4 states, in multiple cities and towns. They're looking at rural versus urban, those kinds of things. So when they originally identified Shirley and Townsend as 2 towns in this region that had a high need, that was based on overdose deaths per capita.
That's what I was, that's what I wanted to ask.
Okay.
Yep. And with Ayer being regional with Shirley, we saw that as kind of an opportunity as well.
Yeah.
Um,
Yeah, there are a lot of times.
so this is really just
I can a little bit more to that, Jenna.
Oh my gosh! Hello, disembodied voice. Go ahead.
Hey, disembodied voice. I know this is not ideal for me to be doing this on the road. But yeah, no, I think basically what Jenna said is 100% accurate, and it's 25 opioid-related deaths per 100,000 residents, so that's the ratio for it. But there's been no increased like no significant uptick since the work of Healing Community Study has been doing work in these areas, but there has been, I think Jane will show some data that there's been at least some level of reduction, which is really important, I think. So we've put a bunch of interventions up, and I can answer some questions regarding those. But the idea of this SSP work would be kind of continuing the investment that National Institutes of Health have already put into this area. So it's like an extension, the sustainability part, but there's also just a really valuable component on being, kind of on the cutting edge of doing this work in a region that's very underserved and could really benefit from it. I'm not sure how to mute, so I think I pressed star 6 again, but.
Okay. Thanks, Nate.
Thank you.
So this is just the law as it's written at this point, right? Section 215, the Department of Public Health may implement needle exchange programs for the exchange of needles in cities and towns. Prior to implementation of a needle exchange program, approval shall be obtained from the Board of Health in the hosting city or town. The city or town shall, in a manner determined by the department, provide notice of such approval to the department, right? Very legalese there, but basically, Board of Health says, yes, we would like these services in our town. They sign off on it, and the DPH does the rest. You don't pay for it, nothing. MDPH funded 100%. So here we have a little model of expectations versus reality and recovery, right? We want to keep our expectations realistic. Addiction is a chronic relapsing condition. Over time, treatment works and people get better if they stay alive, right? So hepatitis C, HIV, and obviously overdose death doesn't help people stay alive. SSPs help us engage people before, at, and after health system touch points, creating more community touch points so that people have more access to the services and bringing the services to them rather than the other way around, right? The convenience factor there as well. And just our final slide here, special thanks to all of us. It's like thanking myself, okay, pat on the back. But yeah, so I guess at this point, turning it over, if I missed anything, Nate, please chime in, and otherwise I will open the floor to Alvic and Jane.
Should we come to the table? Or
Yeah,
should we just
sure.
speak from here?
Come on up, whatever you feel comfortable doing.
I don't want to block the camera.
It's actually over there.
Oh, is it over there?
Yeah.
Oh, okay.
That one.
Yeah.
Yeah, so I feel like Jenna did a really great job of covering, kind of the basics, but I just wanted to talk a little bit about our experience on the study. I started at Boston Medical Center in January 2020, which is also when we started what we call wave 1 of the study. And so we were based in Shirley and Townsend, which for the purposes of the study is considered one community just because the populations are small. And one thing that we noticed right off the bat, I think the map that Jenna showed really does a good job of presenting the situation with the substance use disorder services. I mean, there are, treatment centers and there are hospitals, but in terms of providing these, syringe service programs and other types of harm reduction services, there really is quite a gap in this area. And so one thing that we've tried to do is fill that gap. In some communities, we're able to build on existing programs. Sometimes we have to start from scratch. And so we did try to work with Justice Resource Institute in Framingham and AIDS Project Worcester, and they've both been really great partners and super involved. But for AIDS Project Worcester, Ayer and Shirley and Townsend are all outside of their catchment area because they're in Middlesex County and not Worcester County. And for JRI, they're really more based in Metro West because their office is in Framingham, so it just makes sense for their services to be sort of concentrated in that area. So I feel like having an SSP in Ayer would be hugely beneficial in expanding those, just the mobile van having that access to that, because we've seen that there definitely is a need for these services. So one of the partners that we're working with, Restoration Recovery Center, they're based in Fitchburg. They hired through the study. They hired a couple of harm reduction specialists and recovery coaches to do direct outreach to folks in Shirley and Townsend. And from February of last year to April of this year, they distributed over 550 naloxone kits to residents of Shirley and Townsend, and over 1,050 total to people in Fitchburg and Ayer and surrounding communities. So we're a little nervous to think about what will happen after June. I mean, they're working on getting funding, but even if they do get funding, just based on capacity, their efforts will probably be focused mostly in Fitchburg because that's where they're located, and they won't necessarily have the capacity to specifically, work in Townsend and Shirley and Ayer. And so, just wanted to talk about that experience because we do see that there's this need, and we don't have data that we're able to, we don't have data through all of 2021 yet on overdose deaths, but we have heard anecdotally about naloxone kits that we've or that the outreach staff have distributed to folks in Townsend being used to revive people and actually save lives. So we know that these services work, and so that's pretty much it.
So for people that are listening to this, that have no background, no family members, that just they hear the word syringe, it sets off a big red flag. What would it look like? What does it look like for that mobile unit?
I can speak a little to that, and then maybe Amit can jump in as well. I think, the syringe thing sounds scary. It's not. Most of the time they take in a lot more syringes than they give out. And people are going to use syringes regardless. But I think the more important thing is with the syringe exchange program comes everything else. So it's more thinking of like what other services are brought along, and we can provide some information around some Justice Resource Institute provides a lot of these services, so they might be the organization that comes out. DPH does a lot of work with contacting and figuring out the right organization, but overall it's bringing the Narcan, it's bringing testing, it's bringing medical professionals and also people who work with housing, and it's a whole cadre of components, and it's more than just syringes. So I think a lot of people get kind of nervous when they hear that word. That's also been stigmatized too.
But
overall, I think the main thing is everything else that comes along with it.
Right, and I, to be honest, my daughter is a family recovery support specialist. So everything that you've said, I can connect to 100%. Been there, done that, proud of her now that she's where she is. But I know how I felt when I first heard that, and I know how people that have no background would feel about it, and how to introduce it slowly to them. And I think it's great that it's not only going to be something that addresses the needle exchange, but all the things that go along with that, the hepatitis, all the other infectious disease, all those things.
Really all the social determinants
All the
of health.
Exactly.
So a mobile unit pulls into a community. How often do they come? How do they decide the frequency? And I'll listen. Go ahead.
That's a great question. I am not actually that familiar with the logistics of it. I don't know.
Yeah, this is Avik Chatterjee. I'm a physician trained in internal medicine, pediatrics, and addiction medicine. I work at Boston Healthcare for the Homeless and Boston Medical Center. I think the way that this particular van is going to be built out is going to depend on the way that the communities and DPH will come together to build a plan. Even in Boston, the major syringe services program where I am over close to the bigger shelters and things is only open 5 days a week, which is a problem because people will talk about on weekends and even nights needing help and needing clean needles because they don't want to infect themselves with HIV or hepatitis C. So I think as we move forward and as we become, I think, more creative in our ways to address overdose, the overdose issue, opioid use, as the number of overdose deaths go up, I think we have to be a little bit more creative about the way we, put services out there. It can't be like I don't want to say, a Monday to Friday 8 to 5 is a traditional way of doing things is not going to be the way to go. And so figuring out a staffing model by which, folks can be where people, need them when they need them is going to be important. But to my knowledge, DPH isn't going to say, okay, like it has to be this hour in this community.
Right.
I think
Yeah.
communities get to help shape how that's going to be.
So who then actually like owns and operates and maintains the mobile?
Coordinate.
Yeah, coordinates, like where is it
Yeah.
gonna be when, what staffing do we need?
That's a good question, Jenna. Do you have more information about
So
that?
that would
Any-
be like the agency, so the agency, the DPH contracts to bring that mobile service into the
Okay,
town. So
okay.
like it could be, well, it wouldn't be because it's Worcester, but AIDS Project
Well,
Worcester.
it could be
right?
because right now their contract says that they are only supposed to work in Worcester County, but I guess
Right.
if they were able to adjust that contract with the state, then maybe they would be able to expand it.
Okay, so in
I
a
don't- but I don't
hypothetical
know.
world, it could be AIDS Project
We're a
Worcester.
strange part of Middlesex County.
Yes.
We are not Cambridge.
Yep.
Yeah.
Right, so they would be coordinating that stuff on their end, is my understanding.
Mhm.
The other thing I will say is if you have a lot of questions that we can't answer, we have Department of Public Health and BSAS, as well as an agency out in the Berkshires, ready to come talk to you and answer some more questions. The agency out in the Berkshires has been doing the SSP thing for a while now and would be able to speak more to what it looks like in a rural area, right? So we've talked to them a lot,
Interesting.
but
So they're like the contracted provider,
Or-
a contracted provider in the Berkshires.
I'm not sure. It's an agency that has offered them. Nate, can you answer that question?
Yeah, can you just repeat it?
Yeah, so,
Can you repeat the question?
oh yeah, go ahead.
Yeah, so I was wondering if the place that was mentioned out in the Berkshires, are they like an example of an agency that's contracted to provide these mobile services?
Yeah, I believe so. So it's Tapestry Health,
Tapestry,
so
yeah.
they do a lot of mobile work. I think they also have some brick and mortar SSPs as
Yeah.
well.
Oh, okay, I see the Tapestry locations, yeah.
And then they do some
Yeah.
outreach to more rural areas.
It's amazing there's nothing in Lowell. We're not
Well,
that
There
far. That's
is-
Lawrence,
Yes,
right?
there is
Yeah.
a Lowell, I mean, I guess because of the way the map is, it's hard
Yeah.
to tell, but it is Lowell, that little
Oh,
blue van that's
wow,
under Lord
okay.
Greater there, yeah.
Okay.
But
Yeah,
there
okay,
is that
okay.
big open range
Yeah.
right there in the
Yeah,
middle
yeah,
of
I
Worcester.
know.
Right.
Nate
right.
actually, we went and toured the Recovery Cafe in Lowell, and then after that, we were able to walk down and see their SSP.
Yeah,
It's
Life
pretty
Connections.
cool.
Yeah,
Yeah,
Connection
yeah.
Center, and I think Healthy Streets, which is based in Lynn, also has a van that goes to Lowell. So I guess that's another example of, an agency that's located outside of the community that does provide services in the community. And I'm not sure how often.
And I just also want to say, when we talked with JRI, Justice Resource Institute, and they were thinking about doing this work, one thing they said is, we can kind of come, part of harm reduction is thinking about meeting a person where they're at, but we can also meet a community where they're at. So it doesn't need to be like, 7 days a week, 8 hours, right? So it's based on
Yeah.
need and timing and presentation and getting comfortable in the community, getting people to know what the service is and having conversations. It's not like you write a letter of approval and the next day the mobile van's like driving down the street honking their horn.
Yeah, yeah.
So it's just thinking through the best way for each community, and each community is going to be different. Ayer's going to be different than Shirley, and Pittsburgh is a different location completely. So it's really thinking it through in a meaningful way and not just jumping into it. So that's why we want to kind of have a few conversations with you all moving forward.
But how do those other communities, like us, like our community that haven't had anything like this, how do they get the word out, and how does it begin, I guess is my question. Especially since we're not a city, Pittsburgh, Lowell.
Yeah, that's a good question. I know like Jennifer Kimball, who's volunteered to come and speak. She might have to do a Zoom or like a phone call like this. But she has a ton of experience. I think she's actually working for DPH now. They've hired her to do some more of the rural approaches to this work too. So she'll be a great person to answer that
That's
question.
definitely.
I think it definitely sounds worth pursuing to me. Sounds like a great investment. Yeah, and I'm sure that we're down one person tonight,
Right.
so
Okay.
he's going to have a lot of questions too, I'm sure.
Yeah.
But I doubt he's going to be opposed to this in any way. So yeah, I think we
Great.
should get a dialogue going on
Yeah.
what is it you need us to do? What, you know,
That sounds great.
how do we
Yeah.
take the next step?
So the next step toward approval is bringing it to a motion in a Board of Health meeting. And then
Okay.
there's also like a form letter from DPH that you sign
Yeah,
off
that's-
on. You send
okay,
it with a
good.
certified copy of the minutes from the meeting where that was
Okay,
approved to
okay.
a specific person at DPH, and they take it from there.
Okay, got it.
Yeah.
Do you know anything about, have other towns, is it just handled within Board of Health, or is it, like, do they have some kind of public hearing, or?
Yeah, it's a great question.
That's a good question.
Yeah.
I'm not really sure. I mean, I think it seems to me it's mostly just specifically with the Board of Health, which
Yeah,
is an open
yeah,
meeting,
yeah.
so the public can attend, the public can listen to the recording,
Yeah,
right?
this is true,
So,
yep, yep,
I don't believe in general it's been like a big, huge open public forum thing.
okay.
But
If
it's a very
anyone's
good
out there
question.
listening and you have an opinion, or
Or
you want more
question,
information,
yes.
let us know, should send an email. You know, we post when, I think there'll be another meeting with, you didn't come all the way here from Boston, did you?
Yeah, we did.
You did?
Yes,
Oh, thank you
That's
so
very
much.
nice.
Yeah.
That was a sacrifice, thank you.
I just want to make sure that the people, like I said, that don't have any background or any connection to this, don't immediately go, nope.
Yeah,
not
yeah,
that."
absolutely.
And that's,
Right.
that's
Yeah.
what
And
you're
I-
gonna get, you're gonna
yeah.
get that from some.
Yeah.
And I think
Yeah.
it's, so with you guys, right, it's an SSP, because in Mass General Law, that's how it's described, right?
Yeah.
That's what you guys have to sign off of. In reality, that's a sliver of the picture of the services that got brought to town, right? We're even talking like basic wound care.
Right.
I like to think of it more for a public standpoint, for if you're like, I need to work on gently introducing this concept to the public. It's mobile harm reduction services.
Yeah.
It's so many different things wrapped into one, and the syringe service part is very important, but it is only part.
Part of it,
Yeah.
yeah.
Right.
I think how we
One-
listed on the agenda is the best way to do that as a harm reduction.
Right.
slash-
Yeah,
And
exactly,
then
yeah.
when this all comes to fruition, like with helps with Cindy, whoever's doing the Board of Health, to put this out on Facebook that the board will be talking about it on that meeting.
yeah,
And that
yeah.
kind of involving the public without having to do a public hearing, because I don't know if it has, I wouldn't think it had to be, but.
It doesn't sound like
Yeah.
a public
Doesn't
hearing
sound like
kind of
it.
thing.
So
Yeah.
if that ends up being
Yeah.
the case, just doing that, I think would help, and having on the calendar.
Yeah.
If we had a date in mind, a few weeks ahead of time, we can have that posted on the Facebook page of the town's website ahead of time, so people know it's
Yeah,
coming,
yeah,
so we're
yeah.
not.
Yeah, because Tricia's right, it's a scary word,
Mm-hmm.
but, so I want to make sure that everybody has
Yeah.
an
But
opportunity
we
to.
do have a need, we have a population, not
Yes.
just for
Yeah.
that, but for
Correct.
all the other parts of it.
Yes.
What was I
Yeah.
gonna say? Yeah, oh, so this presentation, is there any way, Heather, that we can get it onto our
Sure
page? So that if people.
I was thinking of that.
Yeah,
it's
Yeah.
it's
Send it
on
to
our-
us.
yeah, I have it. So and Cindy has it as well.
Okay.
And so we can definitely get
I'll
that
send it
on
tomorrow.
get it on tomorrow.
Thank you.
Yeah, that'd be great,
Yeah.
let's
But we can
post
start a
it.
whole new tab on the Board of Health page for this. So anytime materials come in, we can just add it to there, like we do
That would
with
be
COVID
great.
and Triple E and all the other things.
That would be fantastic.
Yeah.
That would be
One thing I'll add, you mentioned folks who might be saying, well, this doesn't happen in our town, and if we do this, this will sort of bring bad elements in. Well, the statistics, like we talked about, show that there are people overdosing and dying in these communities, rural communities out here.
Right.
And the sad thing is, with the data we have from Healing Community Study, we can actually tell exactly where they're dying. And what's the saddest is when they're basically dying alone, using alone in their home, you know?
Yeah.
And you see these maps and they're just in their homes alone using, and have no help and no support, feel so
Yeah.
stigmatized that they just want to be, away from other folks, and they overdose and die. What we're trying to do through these harm reduction services, the services we're providing, is give folks someone to talk to, try to break down the
Yeah.
stigma, so if they need help, they can ask. They know where to get Narcan needles, they can get counseling around not using alone, getting all that stuff. That's what this is about. It's about knowing that people are dying and knowing that they're dying alone, and trying to change that so that folks get help. They're not in that
Yeah.
situation where they're forced into the dark. So that's the goal.
Is there an emergency component to this typically? I mean, it sounds like everyone is set up a little
Yeah.
differently, but being as how we're a rural area,
Right.
is there any provision for even a telephone contact?
Yeah,
for
so
someone in the
JRI
middle of
has
the night?
developed an app. Actually, you may
Yeah.
be able to speak more specifically to what the rollout situation is, but they have this really cool app that has access to all sorts of resources, but built in is this service of Never Use Alone, where even if you are alone in your apartment, you can dial this confidential app where someone just stays with you while you're using, and if they're alarmed that you're not responding, they can call for help based on where you
Isn't
are.
that cool?
But it's all wrapped up into
That's
this app.
amazing.
It's bilingual, it's English, Spanish. It has a ton of other resources and where you can get treatment, but it has that feature. There are a bunch of different actually apps and helplines around that, but allowing people to not be alone when they
That's
use is part of
astonishing.
what
Yeah.
this work is. Yeah,
Yes.
for sure. And giving people tools for that.
Right.
What a brilliant idea. That's incredible. Yeah.
Would it be possible for us to return for one of the June meetings?
I think so.
Hybrid? Sorry, I couldn't find that
Yes,
word for the longest
because
time.
I feel badly that we had to travel
that's
so
why-
far, we
that's
made
why-
it always
it's
just.
a very
you know.
scenic drive.
Like, we can have you on telephone
Sure.
or Zoom in or
Yeah.
whatever,
Yes.
whatever is easiest.
Okay.
And in the-
Because I know after this, there'll be a lot more questions.
Yeah, and,
Yes.
Yeah.
and in the meantime, we can connect you to Jennifer and like just make sure that we have all the answers because there's a lot.
Jennifer Campbell?
Kimball.
Yeah.
Yes.
Mhm.
Mhm. Yeah, and then,
Great.
people, if we have people from Berkshire Medical Center or Tapestry who would like to join us for that would be,
Mhm.
obviously,
Yeah.
they'd be able to do it as well. So that would
Yeah,
be
I'd be
great.
really curious to see how in a comparable, spread out
Mhm.
rural
Rural
area.
area.
how does it-
Exactly.
I can envision this really well in a city.
Yes.
Yeah.
Yes.
But
Mhm.
Yeah.
I'm not sure how it,
How it would
would
translate to
actually
the setting.
translate.
Right.
Yeah,
Yeah.
the logistics of it.
Even in the city,
Yeah.
so Boston, we work with a brick and mortar SSP, AHOPE where we are, but the city identified that there were a bunch of clusters of overdoses away from that SSP and away from the health centers, and so we ended up getting a van with help from the Kraft Foundation, but basically we worked with the city, by we I mean Healthcare for the Homeless, and we set up mobile clinics out there where we provided harm reduction services and access to medications for opioid use disorder in parts of the city that were sort of deserts like that. Like the city would have a
Yeah.
map like that and be like, oh, this one neighborhood, it's far away from from all the
Yeah.
services,
Right.
and we need to bring a van there. So that I feel like would probably be part of what
Yeah.
Yeah.
would go on to figure out where the van would go.
Yeah, for sure. Because we've heard, again and again, that transportation is a challenge in this area. So I imagine that's not just between towns, but even like within the town. If you don't have a ride, and it's however many miles away. So I'm sure we could,
Yeah.
work through that and figure out like where it makes most sense to have the van
Can I ask
station.
a quick question? Are you working, because of the 17 towns in the show, but are you going to all the other boards of health to put the same thing, or is it just specifically Ayer, Townsend, and Shirley?
Air, and then also Berlin, possibly next. Their social services coordinator, Victoria, and their police chief, Chief
I'm just
Sharner, are
wondering,
very interested.
because that gap that we have there shown is actually, with the show, but it's quite a bit of that upper part.
Isn't that?
Yeah,
isn't that
yeah.
So I was just
True.
wondering, if you
Yeah.
the other towns, the other Neshoba towns as well with this.
Yep. So Berlin is next on my
Okay.
list, but certainly I would love to bring it to all the towns. I think it would. I really, because when I first did my little, what are the areas lacking in terms of social determinants of health around here, right? Mental health, substance use
Yeah.
disorder, transportation were my top three,
Yeah.
right?
Yeah.
And this is a service that I can see addressing, obviously not all of those needs because they're very broad, but a good chunk of them, and especially eliminating the barrier of I can't get from where I am to the help that I need.
Yeah.
I have another devil's advocate
Mhm.
question, different perspective,
Yes.
not from my own.
Mhm.
How, when somebody comes to you and they are someone that comes over and over again, and they're still using, and they're coming and they're doing a needle exchange, you don't track, I don't mean track, but I mean that person comes over and over again, and do you talk to them each time that they come and have a recovery person there, or I guess I'm saying, like, how many times do you see them come in, and if they're starting to fail and getting worse,
Yeah.
is there a is there some kind of a catch that you guys have
Right.
to, either by having counselors in the van or?
Yeah.
you know,
Well, so the
you know,
scientific evidence from the years of experience with SSPs shows that people who use the SSPs are much more likely to engage in treatment, whether that's detox, residential treatment, get onto medications. I think more and more as we do this and build newer models, it's going to be harm reduction services, which are very important, but we're going to start being able to pair them with medications, which we know save lives, prevent overdose deaths. There was a study that I helped with out of BMC that showed that if you offered buprenorphine, which is a medication for abuse disorder, on it with SSP services, that you had, I forget the exact numbers, like a 79% decrease in mortality, but like a tremendous decrease in deaths from that combination of things. So one of the things that we've been doing as part of the Healing Community Study is that we have 3 different prongs to the intervention, but people can put money toward harm reduction services, services that increase access to medications like buprenorphine and methadone, and then educating prescribers around safe prescribing. But I think the best interventions tend to combine these two, the harm reduction and the medications piece.
Yes.
And so anyway, but even without like this newer model where you have the medications available
Right.
on the van as well, it's true that people who engage in SSP services, because they're not alone in their apartment using and all that, they're much more likely to engage in treatment. And so that's just what we want.
So, is there a physician or an NP in the van
So
that
there could be.
addresses?
There could be. That would be something that JRI could work on. That's a model that we have implemented in other places.
In like the
Yeah.
cities, they definitely.
Not just the city. So part of Healing Community Study, I want to say Brockton. Brockton has done it. Brockton has combined mobile, MOUD, and harm reduction. And I'm forgetting the other communities. I should know them all. But there's 4 or 5 communities. I think Gloucester and Salem have as well. They've both done that, where they've said, okay, we have money for a van, but we also want an NP or a doc on there that prescribe
Right.
buprenorphine. There's 4 or 5 communities in Massachusetts who've done that as part of the Healing Community Study. So
Because
that would be our goal.
We had an opioid,
Mhm.
tried,
Mhm.
have a symposium a couple of years ago. We had some great speakers and some really good resources that came. And back then, and I don't know if it's still true, there was only one physician available up at Stewart that could prescribe. I don't know if it wasn't methadone.
It was
It might have
probably
been
Buprenorphine,
Yeah.
Suboxone.
Suboxone,
Yeah.
okay. And then there was another one that was an injectable.
Oh yeah, Vivitrol.
Vivitrol. But if they're given prescriptions or they're steered in that direction and there's only one physician in the area, how do they access this?
That's a
those
great
prescriptions?
question. So
Yeah.
that's something we're struggling with in a lot of these communities as
Okay.
well. But one part of our intervention in Shirley and Townsend is Stephanie Strategos, who's a doctor out of Emerson.
Oh,
We
okay.
set up now it's two sessions, or is it one session still one day?
I think maybe
Bill
2 days a
too.
month.
Yeah,
At
yeah.
their they have a primary care clinic in Groton.
In Groton, but it was exactly what you said. There wasn't anybody anywhere around there
Yeah,
prescribing.
why
it.
is that? Why is that such a big deal to have, to
That's
be
a
able
good
to
question.
prescribe that?
Is
So-
it like an extra certification?
So
or
it
something?
is.
Okay.
So and there's a whole history that has to do with stigma. So I think there's a lot of
Okay.
stigma around addiction treatment. So when methadone got set up, it's the oldest medication for addiction. The government said, oh no, not just anybody can prescribe methadone. You have to be as part of a methadone clinic. You have to show up every day. So there are all these rules around methadone. Buprenorphine is much newer. It's only about 20 years old. It's about around 2000 that it was allowed to be used to treat addiction. So they said, okay, so clinic regular doctors can prescribe it, but they have to do 8 hours of extra training. So what we find is that it's not just the 8 hours that are the barrier. It's a little bit like, oh, this is a whole nother level of medication, which is not true. Honestly, in my mind, OxyContin is way more dangerous than buprenorphine, but I don't need extra training to prescribe OxyContin. I can just do that fresh out of, or even if they're in residency. Anyway, but that barrier is there. And Vivitrol actually, it is the 3rd FDA-approved medication. You don't need extra certification to do that. Anyone can prescribe it. Unfortunately, it's not as effective in terms of saving lives as buprenorphine and methadone. So buprenorphine, you do need a little bit of extra training, and you sort of have to want to do it. There's a lot of stigma around.
And the
prescribing it.
Suboxone isn't it a tapered?
It can be. So in our experience, all the science shows that the the longer you're on, basically the better. You, as soon as you taper off, you tend to have an increased overdose risk again. So there are people, I think people who are stable and have, the strong desire and have shown that they're sort of in a good place where I think over the long term you could argue that you could slowly taper off. But most people need to be on it at least a year to, I think, maximize their overdose prevention. What I try to get people to think about is like being on insulin for diabetes. No one really wants to be on insulin for diabetes, but at some point the disease gets to a point where you do need it, and you do need it for a long time, and you may need it for the rest of your life. Now there's some things you can do to try to help your body like sort of decrease their need for insulin and all these things, but rather than bet on that, we want to keep you alive and do the things that, and put you on the medications that you need to be on for that reason.
The other thing, I'm sorry, I'm going over, the Narcan, is that something that would be available in the vans? Would that be
Absolutely.
passed out?
Yes,
Yeah.
and that's another, because the Healing Communities study is leaving and we're not gonna have this Narcan, just people just handing it out. This is an option for that to continue
I see.
without anybody
Yeah.
having to pay any money. The DPH takes care of it, so
Yeah.
I love that. Oh my gosh, that'd be great, especially where we have this demonstrable evidence that it works to prevent overdose deaths.
Yeah. And there are no restrictions on that in Mass, right? Or
Correct.
You
You
can.
Right.
do
You
not
just
need a
go get it
prescription.
now.
You
Yep.
can have a prescription, but you don't
But
need
you
it.
don't need
You
it.
can walk
Okay.
into a pharmacy and purchase it. Yep.
Good.
And then there's also, some avenues through which you can get it for free. So,
Huh.
yep.
So,
We found that that's been one of the. I mean, people are somewhat resistant to medication in more rural areas as well. But we found that Narcan and overdose education has just been like such a wonderful thing for this area.
Yeah.
And yeah, I'm personally a little nervous of just leaving because it does leave a hole from what we created. And Narcan is just really easy. It seems much more accepted since we started, and people just want to have it.
Yeah.
Also, a quick side note: there were a couple residents of Ayer that I spoke to, I don't know, maybe like 4 or 5 months ago, and I described this to them, and they weren't using anything, but they kind of knew folks who were, and they were like, oh my god, that would be amazing. Like we would love to see that. We know our friends, the people that we care about, would love to see that. So I've talked to, it's a very small population of people that I've spoken to directly about it, but I think it would be really beneficial for many people. So yeah, I just wanted to put that little tidbit in.
Thank you.
yeah, agreed. Is there we've talked a lot about substance abuse treatments here. What about non-substance related issues? And you pointed out at the beginning that we're also a desert for mental health providers that take the right insurance.
Right.
So
Yes.
that is a huge problem.
Right.
And the other thing I think is somewhat underserved here is just in general LGBTQ health issues.
Yes. Yes.
And are those two things something that are kind of under this umbrella?
Right. Well, with like the
Service.
Hep C testing, HIV testing, things like that, like people can present at this mobile clinic and say, I feel like I need to be tested for HIV. They can get that taken care of, at no cost. And then the linkage to treatment, right? So this van comes with people who have the knowledge of resources and the knowledge of how to access those resources.
Right, the connections,
And they can, so they can maybe help
Yeah.
troubleshoot a little bit. Oh, you need to get to a provider in Fitchburg, but you don't have any transportation. Let's see what we can do about that. Let's get you signed up for
okay.
Mass Health, get you a PT1, like whatever,
This almost
So-
sounds too good to be true. I think
I
that's why I'm having trouble.
I'm aware. Yes.
It's astonishing.
Yes. It's really cool.
So what's our next step?
Next step would be
Get
it
you on
sounds
the
like
agenda again.
get us on the agenda again for a hybrid meeting so that I can have all my peeps not drive.
I know.
Well, we've met you somewhat
Yeah.
face to
Yeah,
face,
no, it's
so
nice.
you
It's nice
can
to-
Zoom.
Yeah, exactly. We're not just floating heads.
Yeah, exactly.
Looking at you, Nate.
Yeah, anyone who's not physically here tonight must appear in person next time.
All right.
Can we sort of use you as our point person?
Please do, yes.
Coordinate?
Can I
'Cause-
just hand you my business card?
Oh,
My
absolutely,
purse?
yeah. So our third member, I think is out all this week, right? Is he? I think he's on vacation.
No, I
this-
thought he had a meeting tonight, and that's why he wasn't gonna be
He
here.
said he had-
Oh, that's right, it
Yes.
was. For some reason, I thought he was visiting his daughter, but you're
No,
right.
I
you're
believe
right.
he just had a meeting, and then I know after the meeting,
Yes.
that's okay.
Right.
I know the last meeting you guys discussed what you're gonna do for your agenda, and I know we had that one on the 6th, but technically, the next meeting, if you're gonna do 2 in June, God help me if I had to fill in
My
for you guys.
calendar.
So the public hearing is the 6th.
Yes, your next scheduled Board of Health meeting would be the 13th and 27th if you're doing 2 meetings in June.
Okay.
Okay. And I do know that, I was gonna mention later in the meeting, Lori Nearing is interested in coming back as well, so.
That's
Okay.
right.
And that would be a separate meeting in itself as well, so you did one on one, one on the other.
Should we keep the 13th and 17th and just,
Yeah, I would say
One
we
for
should
this and
plan to
the
have
other one for
meetings,
Lori?
on the
Both.
13th and
27th.
what?
It's the 13th and 27th.
13th and 27th.
Okay.
Yeah. We should plan on those too, but what happens in each one, that's where I'd just coordinate with Steve, because
Yeah.
I don't know if there's gonna be stuff on the 13th that is gonna carry over from the public hearing.
Yeah, I have no,
or-
yeah.
Also,
So-
what, I know you had said, Jenna, that there's paperwork from DPH that has to be signed and then submitted.
Yes,
And
so
that time frame
Mm.
from start to finish, do you have any idea of what?
I can actually,
How it
I have a copy of what the letter looks like. It's like just some very basic words and they want it on town letterhead. I can
Right.
show that to you if you'd like. I can give you a copy to upload on.
Yeah.
you know.
Yeah, just send it
Yeah,
to.
yeah, if you could
everybody.
send it to me, I could
It
forward
ends up in the
something
right place.
I
Yes,
was just wondering
absolutely.
if you have any knowledge of other boards of health and how they, once they do it, how long it takes DPH to get back and start that process.
When Nate and I were talking to DPH in, oh my gosh, Nate, help, it must have been December or January. I think they said that they had no longer than a 3-week turnaround time before they started working with you to get those
Oh, wow.
services in motion.
Wow.
That was
That's
a while
quick.
ago. That was a few months ago.
Amazing.
That's
Am
very
I
quick.
right about that, Nate?
Yeah, they said it was. They made it seem like it was pretty quick.
Yeah.
They get to work.
Yeah.
They get to work real fast on it.
Right,
It's
right.
something that they're excited about.
They're very excited about it. That's why they'd love to come answer some questions for you guys.
That's
So,
awesome. And DPH covers the cost?
yeah.
There's no
Like,
cost to me then.
state
I
money.
was
Yeah.
asking that question.
I know.
Zero.
Once
Yeah.
the fine
We
print,
needed our budget.
there is
Yeah.
none. Yes,
Quite a
exactly.
value. Yeah, it's
Yeah.
Correct.
Oh my God, that's
So,
a bag of twice.
I guess the thing would be, we can talk to Steve and
Yeah,
find
and
out
then
if
figure out which,
those
which
two
of
dates,
those
the
dates.
13th or the 17th, if you guys, if we
Or
could.
27th.
Is it 13th or 27th?
13th or 27th, yeah.
Yeah.
Like even just to have you on
Yeah.
the phone?
Yeah.
Yep.
absolutely.
Yeah,
Would that
for sure.
work?
Yep. And so that is.
Yeah,
could
if you
be
wanna let
hybrid
me know
for sure.
what
I'm just gonna
works
make sure my
best for
schedule's
you
clear.
guys, cause I feel like the other person, I mean, both items on the agenda, both you guys and in Silent
Yeah.
Spring is another important one, but I feel like this one's got a timeline, the sooner that you guys can
Yeah,
answer the questions.
right.
If it's simple as the next meeting, you guys are doing the vote, so
Yeah.
we can do that on letterhead and get that sent,
Yeah.
then that's fine. And then that's,
Exactly.
you know what I mean?
Yeah.
Because I would assume Steve would wanna come and ask his questions before you have a meeting and
Yeah,
vote on it.
yeah.
So it'd be at least 2 meetings where that vote would come, is my guess.
Okay.
So to me, it'd make more sense to do this one the sooner than
Yeah.
the later.
Yeah,
And
I
then
think so.
at the
Probably
meeting where
good.
you do vote, then we could have Lori come to that one and if she
Yes.
has
Yeah, that's true.
Just because to me, I feel like that's the most
Yeah.
important, is to
Yeah.
get all that information answered so you can be prepared to make that vote at the next meet, at the following meeting. And then do kind of, that in my opinion, I feel like that's the best way to do it if we can.
Okay.
Then that way you get the process going, so come July, maybe you're hearing from DPH.
And why are you leaving us once again?
Because I have a degree in environmental science, I would like to
I know.
So
Doing
Tuesday.
it up to your full potential. I know.
So tentatively, do you want to say the 13th that they,
Yeah, if it works for you
Yeah.
guys, we can tentatively say that. If not, then, I mean, if you just let me know in the next, week.
Yeah.
I can get your act agendas going. For June, no
And then Heather,
problem.
can you just let
Monday,
Steve
so
know
okay.
when,
Yes.
Yeah.
when he checks in with you
Yep.
next? Or?
Yeah, I'll just send an email tomorrow.
Tentatively 13th.
Yeah, just let me, if you
I'm
let me
just
know.
gonna make sure my schedule's clear.
Just let me know within the next week if that works, and I'll just get draft agendas drafted and done for the June meetings. So.
All right.
Sounds great.
Yeah, it sounds wonderful.
Thank you.
Thanks,
Pleasure
Steve.
being here.
Yeah, yeah, it was
Thanks,
great to
guys,
meet you.
and for so many fantastic questions. Yeah,
Mhm. Yeah.
very good.
We've never had such a gift bestowed.
It's amazing what you
Thank
can
you so
find when
much.
you look at what offer the state and federal government offer. There's a lot of great programs if you know how to look for them.
That's the problem, knowing
We
what's
weren't
out
even
there
looking.
and making the
Yeah,
connection.
I mean,
Yeah.
I've seen some like posted on Facebook from different groups, and I'm like, oh, if I worked for because I worked for a municipality, if I had been paying for my
Yeah.
student loans for 5 years, I could get $5,000, $10,000 forgiven, but I haven't started paying for them yet.
Hoping that
Thank you.
grace
I'm hoping
period
that
is
we get
extended
that-
forever.
Yeah, absolutely. Thank you so much.
Yeah, thank you. This is
Thanks for all the
great.
good work you do. Great. Okay. So, let's see.
Do we still have, oh, Cindy's gonna, okay.
Bye, Dave.
Do we still have
Oh, yeah,
Bridget
bye.
on board for COVID-19 update?
She is right there.
Okay.
Bridget.
What's going on, Bridget?
All right.
How many COVIDs do we have?
How many COVIDs?
Is it going up? Is it going down? And does anybody have monkeypox yet? The most important thing. It's like,
1 out of the 3.
this is the zombie apocalypse.
I know.
Bridget, you are muted.
Oh, Bridget.
She was unmuted, then she muted herself.
Hi,
Hi.
Hi.
I'm going to apologize in advance. I have a very unhappy dog.
Oh, okay.
I understand that.
Yodeling in the background, we'll know why. Oh,
Yeah, you might hear her.
okay.
So are you ready for my
Yeah.
update?
Yes.
Okay. So, I did a housing inspection on 23 Shirley Street. I'll be following up with the landlord, but it was done on May 11th, sent out certified. I don't know that we've received the certified back from the owner that they have, actually received the, inspection report. So
Okay.
that
Was
done.
was it bad stuff? I mean, was it like short time frame fixing stuff?
Some of it is, it just, no balusters on stale, on, the hallway stairs.
Okay.
and
No lead
there's a lot of
issues,
mold
right?
on the ceiling in the bathroom. That was just that was weird because it's not, doesn't seem to be your traditional mold from the moisture from a fan that's not working.
Oh, yeah.
The
Yeah.
hot water was, sorry. The hot water was a little too hot.
Okay.
The kitchen floor was in disrepair. I'm
Okay.
gonna move. I'm sorry. She's just not happy.
But no lead paint stuff going on?
So the floor was in disrepair. That might take some time. There's actually a kitchen light that doesn't shut off. According to the tenant, it's never shut off. So we could not find a way to shut this light off. So
That's bizarre.
yes, that is the most bizarre.
Yeah, that is really strange.
The door, there were some issues with door casings, carpeting, electrical outlets. Those are easy fix. The sewer pipe just needed to be repaired. It didn't look like it was leaking. It just needed, the tape around it needed to be
Okay,
redone. And then balusters also for the steps to the basement.
okay.
And then we couldn't do anything really because it was too warm, but it appears there's no heat on the second floor.
No heat?
So we'll be working with the landlord. I mean, it could be very complicated, and we might have to address this at some point in the future.
Okay. Bridget, no problem with lead paint?
There were no children under 6.
Okay,
Oh, okay.
all right, good.
The Air Park Department, we issued them a license for their prepackaged food.
Okay,
We received a decommission application for a well on 11 Willow Road, so we issued that. It's just an irrigation well that they wanted to decommission, so that was
Okay.
issued.
okay,
And then there's 2 food inspections done, one at Family Dollar, one at Gary Archer. Doesn't look like there were any issues with those either.
great.
Did we miss the
All right.
COVID?
So that's really all I have.
Anything going on with COVID numbers trending?
They are steadily increasing.
Yeah,
I think we'll have more numbers tomorrow. You know, we're just telling people again, same thing, please be cautious if you're
Yeah.
attending large events. You know, it's obviously just be aware of symptoms and
yeah, it seems like this lately, I've been hearing a lot more reports of people, and it's all anecdotal, there's nothing statistical, but that people that are
We're
getting
definitely-
it and then getting it again.
yeah, so that's the
Pretty
issue that we're
quickly.
seeing now is there's definitely people that got it before, they're definitely getting it again.
Yeah, okay.
So there's no contact tracing, and I know, I don't know about Ayer. Some schools are going back to pool testing, depending on where the spike is. They don't do contact tracing though, right? We're not.
Yeah, we're not,
Yeah.
they're doing, the nurses are doing some, depending on what's coming in.
I've gotten emails from my kids.
They're following up with some things, but a lot of this is stuff that's not necessarily diagnosed and sent by a physician. There's a lot of self-diagnosis going on, so.
Well, because everyone has access now to the home kits, so nobody's,
Yeah, yeah.
very few PCRs. I remember when this started,
Yeah.
everyone was running over to Emerson and getting a PCR.
True. Yeah.
Okay.
I know, now everybody's like.
Yeah, yeah. All right,
So that's,
Great.
all right.
Thank
Thank you, Bridget.
you are welcome.
Suddenly quiet there.
Yeah,
Yeah,
I
I
had to
know.
move.
Is the dog okay?
Put the dog in the closet.
She just, it's the birds, the squirrels, she just sees something and she has to make her appearance known to that creature, whatever it is outside.
Yeah, yeah. Just gonna put him on notice. Yeah.
Yeah.
I get that.
All right. All righty, thank you.
You're welcome.
So, review and approve the minutes of May 9th. Did you get a copy? Did you
I
look at these?
Just so you know, the email one that was sent, I had Pam's name wrong the first time, and I changed it.
Oh, okay.
So that's the, but if you did review them before over the weekend, there was a change, and I had fixed
Oh,
it.
no, I didn't.
Okay.
And this one has just
This
Steve's.
looks good.
Yeah, it does. So what you would do is, if you want to sign it, you would just sign it for, sign your name and then write for.
So sign mine and put.
Yeah.
Yeah.
That's what I'm saying.
You
Yeah.
gotta make the motion to vote.
Should
Oh,
I put
yeah.
the date? Oh,
I move that we accept
okay.
the minutes of May 9th as written.
All those in favor?
Trish
Aye.
seconds.
Yeah, Drew
All
seconded.
in
I seconded
Yeah,
it.
thank you.
You said it fast.
Yes, I'm
So
sorry.
yeah, you would just sign your name and then for afterwards, so then in the bottom it says Steve. So you
Okay.
sign it for him.
And should I put the date next to it?
Sure.
Because this is for the 9th.
Yeah.
This is the 23rd. And then, bills and mail.
Yep, so the only thing you have in those packets that to be signed is all the chicken permits that have come in. If one of you wants to sign those for Steve, that would be great. There's 10. There's also 2 sets of minutes in there that I have noticed that are not on the website but have been approved. And it's both, I believe they're prior to Steve being on the board. So if you two just want to sign them, that would be great.
Sure.
But going through
Oh,
PDF
we already
survey-
did the.
Yeah, those were last
We already
summer.
accepted them?
Yeah, they were last summer and they just never got to the websites. I think because we were doing
Yeah,
remote
we
and
were
trying to
doing
get
remote
things
so
signed was
much.
just a hassle.
Oh, there's quite a few,
There's 10 so far. And I've gotten one back saying they don't have any, so that's 11 out of the 25 we have. So we're getting there, almost halfway there.
Where is Old Farm Lane?
Pingree.
Uh,
all right.
They had Steve on there, but as long as I have 2 people signed on, I'm
Okay.
happy. It was just a hassle getting signatures.
I know. All right, just that one and that one?
and
Mhm.
this one. This one, so it's coming down.
Thank you.
And what about this? What
So
about
those-
all these that
So
have
those,
Steve's?
yeah, you can just do the same thing as you did with the minutes and just sign your name for.
You wanna split these? Cause there's
There's
like
10.
10 of them.
Yeah.
That one you can do.
And the more we can get done before I'm
Yeah.
move along, the
yeah,
better it'll be.
Agreed.
Yeah, a lot of cleaning up.
And I do this the same way, right?
And just say
And-
for.
Yep.
Do I have to write his name or can
No.
I use the printed art?
Yeah, just use the printed part,
okay.
just sign your name and then for, and
Okay.
it says his on the bottom. If anybody questioned it, all I had to do was look and see who was board members at the time. Just the 2 of you, so.
This is true.
It just happens to be here.
This one, I'm just writing for.
Yes, I am. So Heather, are these, when is the due? You still have a few out?
Yeah, they expire the end of the month, so they don't expire till next Tuesday.
Okay.
So if I have a chance, I might send the second notices out before the end of the week. See if I get any more in the mail. One person came in today. See if I get any in the mail tomorrow. If not, then I'll send the second notices out.
Is it the usual, same people? did
Same
they?
people, yeah, Brian Ruthier came in, Jim Tillotson came in, yeah, the one on Washington Street with theirs, Pleasant Street. Yeah, it's the same people.
Yeah, I know, the addresses seem to be pretty consistent.
Yep.
All right. Here's
Oh,
those.
right, and you. I'm just curious. Oh, yeah, one, yeah.
And this is just the mosquito control
Yep, that
project.
came in today with the list of the dates.
The dates that they're going to be spraying.
Yeah, they don't start till after Memorial Day. So usually the town clerk gets a copy of that, and she usually sends it to Cindy to get posted. If not, I'll scan it tomorrow, and so it can get posted.
So it says any of the dates that they'll be spraying are tentative, May 31st,
Yeah, they're always
June 6th, 13th, 21st, and 22nd.
And where are these spraying?
Mondays, every Monday.
Yeah.
It's
Is it
whoever
just
it's-
in the town in general?
Yeah, it's whatever their designated
Yeah.
areas are. So if anybody wants to be on the spray list, they have to call, and those are the dates that they'll go.
All right, if you want to be on the no spray.
Yeah.
Yeah,
No
yeah,
spray list, you actually have to write a letter. It's a lot more detailed to be on the no spray than it is to have them come and spray. So if anyone who doesn't want to be sprayed, the sooner they notify them, the better, because it
Yeah.
it is a lengthier process.
So anyone that is interested in this, it's www.cmmcp.org, and you can find out more information, or you can go on, click on the no spray info.
Yeah.
But
Because I had to look into that for somebody else, I think last year, and I was like, oh, well, that's quite the process. I'm like, you don't have time before they come spray again.
all right, there's that. And then action items, we already talked about putting Jenna on, and possibly the other, the physician and the other.
Yes, have them come back on the 13th if they can,
Yeah.
and like I told you, like Lori Nearing had contacted me, she wants to be put on an agenda.
For the 27th?
She was hoping sooner, but I feel like as a board too, you'd find this,
Yeah.
the harm
Yeah.
program
Ye-
more.
yes.
I mean, not that it's not more
Not-
important
yeah.
than PFAS
And
in
Lori's
that
is
study.
just-
Right,
It's
right.
just,
Right.
it's just a timeline issue, right? You need to get all your
Yeah,
information, so then
exactly.
you can get the information to
Right.
vote and then go. So that's,
Yeah.
I'll try to explain that to her. If she has any questions or concerns about that, I might have her contact one of you.
Yeah, and I spoke to her, I saw her Saturday at that wellness, there was
Okay.
a wellness
Ah,
thing.
great.
Okay, so I'll just email her tomorrow and let her know that she'll be
Yeah.
on for the 27th. If she has any questions or concerns on why I get pushed back, I'll just have her reach out to one of
And,
them.
yeah, it says Silent Spring Advisory Board, she was looking for,
Yeah,
Remember-
Pam had
Yeah.
mentioned at the last
Yeah.
meeting, so that's why it was on here today. I don't know if you wanted to discuss that today or if you wanted to wait till Steve was here.
I would wait until Steve is, yeah.
yeah, and we can discuss, I took the flyer from Lori about, people that wanna be involved in the study.
Okay.
Um,
Is that something you want to see us put on the Board of Health
Well-
page?
Yeah, maybe you should.
Okay.
And this is, it talks about eligibility.
Can I have that or can I just go make
No,
a
you
scan
can have
this?
it.
Okay, so I can just scan it real quick and you
Yeah.
can write back.
And it has all this on the back too. I just
Okay.
grabbed it off her table if you want to pass that to Heather.
I'll get that scanned and put that on the web and have Cindy be so kind as to put that on the website.
So we got a lot of good information tonight to go on that website.
We'll get some, yeah. And I said, what we'll do is we'll
Yeah.
sit down and we'll start a new tab for that information. So
Yeah.
anytime she sends us something, anytime a meeting's gonna be posted, we can just build off on that. So then when it does get up and running,
Yeah.
people will know where they can look
Yeah,
for the
I like
information and where it's gonna be, even if it's not in Ayer, if it's in Shirley or Townsend, they can
Yeah.
know where to go. So we'll just start a whole new tab on the.
And
Board of
I
Health
had
page for
said
that.
to,
I
so
like the
Lori,
information pages.
Yeah, it just makes
it
it
Yeah.
easier.
easier.
Went to the same place, we can make a short URL.
And if it's
Oh,
something
slash
like that
SSP
too,
or
that we know is gonna be active,
yeah.
we can put a link to that right on the main page as well, to go to that one.
Yeah, that seems like something.
So I think we did that with
that's
COVID,
gotta
we
be
had it right on the main page, plus you could find it from the Board of Health page or something like this. When it gets up and running and we know it's gonna be coming, we can have that link on both places, so it's easy to find for people.
And I had said to her that I apologized with everyone's different schedules that, we weren't able to go to all the meetings and some of them are
I
at
know.
10 a.m.
They
during
have
the
a
week.
meeting tomorrow
Yeah,
that
and-
I'd love to go to,
I
but
can't.
I know,
If we
Tuesday
were.
mornings I have a 10
Um,
o'clock call.
But I did reiterate that we did want to be connected
Yeah.
and work together and keep, updates, so.
Yeah, so we'll
she
get a
knows
new
that.
tab for the Silent Spring, the PFAS, I don't even know if there is one right now, but we'll get that one, we'll get one for the harm to reduction
Harm
study,
reduction, yeah.
program, and we'll get all that up and running and start filtering that stuff through those.
I like your idea for what to use for a header for it.
Yeah, I think if you put the syringe program in, that's fine, but the first thing you read is harm reduction, you're like,
Right,
oh,
right.
okay.
Yeah.
So the syringe
Yeah.
thing, well, what could that be? You know what I mean? You might not read the whole thing. You know what I mean? Because when
Right.
I read it, I'm
Yeah.
like, oh, what's this? Harm reduction. Okay, and then she starts talking like, oh, that didn't even click in my head that that's what that
Well, it
was.
sounds like that's closer to describing the total package.
Yeah,
of,
it's harm reduction.
of what they're doing.
It's
This isn't
basically
all
almost, yeah, it's almost
swapping needles.
Yeah.
Right.
Which, if anybody watches, I think John Oliver on last week did a whole thing on this program that he
Oh,
started.
really?
And I can't remember how many weeks ago it was, because I don't watch him on Sunday. I watch him like
Yeah,
Tuesday
I
nights
watch it
usually.
lately too.
But
I haven't seen that
he
one
did
yet.
he did a whole episode on it about the program that Biden started and this whole thing and the stigmas and stuff on it. It was a whole one of his
Oh,
episodes on
God,
it.
I can't wait. Now I'm gonna go home.
I'm trying to
watch
find it. Yeah, it was this.
Yeah.
There was this season, so it was so it shouldn't be too hard to find.
It must be in the last couple of weeks because those are the ones I haven't watched.
Yeah.
So.
All right. So, I guess that's it for
We have
tonight.
nothing-
We have nothing further.
Have nothing further. Bridget, anything to throw in?
So I was having a little hard time hearing. Did you sign the chicken permits?
We did.
Yes,
Yep.
we did. Yep.
Okay. So did everybody, Heather, get permits that needed them?
Everybody got sent permits applications that I know have animals on their property.
Does that include, so everyone who has animals on their property has permits?
Has been issued a request to issue one. We've only issued 10. Before the end of the week, I will send second notices.
Okay.
Okay, we've
So
only
how
issued
many are outstanding?
10. There is at least 15 outstanding.
And
Okay.
when's the cutoff? When are they?
The next Tuesday, the 31st.
And how long do we let that go? I mean, we've been.
I mean, I've
I've
had-
had
yeah.
some stragglers
Yeah.
come in late.
Yeah, what usually
So
happens.
that was just what I wanted to make sure that we followed up on the, all the chicken and then anybody with animals so that we could, for
Yeah.
inspections for Julie.
Yeah,
Oh,
usually I
yeah,
will send her
yeah.
an updated list, so what I will do is I will send her the 10 that I have and the ones that I haven't gotten yet. So she can keep an eye out on those, and as it updates, I'll send it to her so she knows who she needs to follow up on to make sure they
Yeah.
get their permits. I mean, we all know.
Okay, is there any way that you could copy me on that?
I sure can.
Thank you.
You're welcome.
Okay,
All right.
that's it.
Okay,
Wonderful.
all right.
With nothing else to discuss, I move that we adjourn.
I second that. You made a motion. I
Yes, I move. I made a motion. that we-
That's
I
okay.
moved.
I know what you meant.
I second that. All those in favor?
Aye.
Aye.